Microphone's in your hand. There you go.
You said that the tamoxifen prevents, 50% of cancers. I've also read that estrogen alone can reduce cancer incidence by 40%, and they seem absolutely contradictory. Are they preventing different types of cancers?
So this may bring us right back to the front row. Patty, you want to stand back up? Does estrogen prevent breast cancer?
So this is a complicated question. In the Women's Health Initiative trial, which was the very large trial funded by the NIH, where they looked at women who were either put on estrogen and progesterone or placebo, and those were women who had a uterus, so they had to take progesterone, or there were women who had already had a hysterectomy and they could take estrogen alone. And this was to really evaluate the benefits or harms of hormone replacement therapy in postmenopausal women, to see if the cardiac risks were reduced, because that was thought to be a very important outcome from this kind of therapy, whether symptoms were managed, and whether there were adverse effects such as breast cancer, colon cancer, blood clots, and so forth. So at the end of the day, in these two trials, the women who took the combined modality therapy, that is estrogen and progesterone, and we can argue about whether that was the best combination or not, but basically these two types of hormones, had an increased risk of breast cancer, had an increased risk of blood clots, and had a reduced risk of colon cancer. So that was an interesting finding. And because of those adverse findings, and they didn't have a reduced risk of heart disease, and in fact, there was an early increased risk of heart disease. For those multiple factors, the trial was stopped early, and of course, as breast cancer people here, we're all interested in the breast cancer outcome, which was a harm in terms of an increased risk. Paradoxically, though, the women who were in the estrogen alone arm, again, women who had had hysterectomies for a variety of reasons, some of them had actually had their ovaries removed as part of that, were given estrogen alone. And with that therapy, there was about a 25% reduction in the risk of breast cancer. So, again, this is the paradox. This is in postmenopausal women only. They were not high risk for breast cancer. Again, these are some of the caveats that we were going to talk about. So as an example, in women who are BRCA1 and 2 carriers, who we have to do, or we recommend often, preventive oophorectomies to reduce the risk of getting ovarian cancer or to reduce the risk of breast cancer, we, our colleagues here, in some of them in the audience, have shown that it is safe to give back small amounts of estrogen replacement to those young women, say a 35-year-old who has her ovaries removed and takes it till around age 50, that there does not seem to be an increased risk for breast cancer in those very high-risk women. Now, would we recommend to the general population of women that if they want to take hormone therapy at menopause, that they should have their uterus removed and just take estrogen alone? I don't think we want to make that recommendation. But if you happen to be in that situation, you're probably not increasing your risk of breast cancer, and there may be a reduction.
But it's fair to say, I think you would probably agree that, on the other hand, you would never advocate for any more or longer duration of these drugs than needed, and you would not at all advocate estrogen therapy as a prevention. The effect of tamoxifen appears in indirect comparisons to be much larger, and it's more consistently seen across more trials than this observation.
I think, again, well,
no, breast cancer. We're talking about breast.
I don't think there's any question that the vast majority of breast tumors are hormone dependent, and that if you take a postmenopausal woman and do something to increase her estrogen levels, that you may be, in fact, if a tumor is there and it's occult, may in fact be leading to progression. But in this large study, these were not high-risk women. They also had had their uterus and sometimes their ovaries removed, so they may have had a cancer prevention intervention. We don't see an increased risk, and certainly those women can take it. But I think, as Dr. Hudis said, we don't really recommend long-term therapies with either of these, because the benefits in terms of heart disease are not there, and the benefits in terms of other health benefits are small.